once again urging Americans to get vaccinated against COVID-19 because infections are once again on the rise.
The Dallas-Fort Worth Hospital Council says there are 237 COVID patients in area hospitals. That's double from a month ago and triple from 2 months ago. Pediatric hospitalizations have also increased significantly. Fox's Carolyn Shively has a look at when the newest vaccines will be available.
The White House plans to renew its calls next month for Americans to get their COVID booster shots this fall. It comes as the CDC reports a spike in infections driven by the Eris subvariant.
It's summer. People might be spending more time inside, especially with all these heat waves we've been having.
According to the agency, more than 10,000 people were hospitalized with the virus during the week ending August 5th. That's a 14% increase from the week prior, but an improvement from this time last year when more than 41,000 people were hospitalized. Still, health experts warn those numbers could rise.
Partly because of the waning vaccine immunity, and also the increase in travel, and also the new variants that are circulating right now.
Moderna and Pfizer expect the FDA to authorize their updated boosters by the end of the month. Then it's up to the CDC to approve the formula. A Biden administration official tells Fox Business on Monday it expects the shots to become available in September. Quote, "We know that vaccination against COVID-19 remains the safest protection for avoiding hospitalizations, long-term health outcomes, and death." Federal officials.
Right around the corner, local health officials say it's time to start thinking about vaccines.
That includes a new COVID booster that will soon be available and is expected to protect against a new strain of the virus now called Eris, or EG5. We took our questions to UW Medical Center pulmonologist Dr. Vin Gupta for answers. What's causing this uptick with coronavirus again right now?
In the case of this subvariant, COVID Eris, what we're seeing really pop up across the world is it's becoming more transmissible. It's stickier, that if you inhale it in the air, if you get even quick exposure, say a few minutes to somebody who's infected, through mutation, it's become a lot more infectious, much more contagious.
Is there a worry that we may return to those moments that we experienced during the height of the pandemic?
Am I worried that in certain pockets we're going to see hospitals get overwhelmed because of COVID, potentially because of flu and RSV, all these viruses that are now out there? Yes, I am. Do I think it's going to be to the level of March of 2020? Unlikely. However, we are living in a really uncertain time.
Is it time we dig out those masks, some of us, and try those again?
You know, I don't know why this has become such a controversial topic, seemingly random, and makes no sense to me as a pulmonologist, especially if you're a higher risk from a medical standpoint, if you're on dialysis, if you have type 2 diabetes, if you're on cancer chemotherapy. You should be masking up even if you're going to the grocery store. That's my view. That's just the world that we live in today. But even if you're perfectly healthy, why not avoid getting sick if you can avoid it?
3 viruses, flu, RSV, COVID. How should we get vaccinated for these 3 viruses?
Yeah, I'm glad you asked that, because this is a source of confusion now. If you're 60 years of age or older, or if you're somebody that classifies as medically higher risk, I personally believe you are eligible. You can allow your body to have a little bit of time before.
Now, it takes COVID cases are climbing here in Ohio, a new variant being blamed on the recent uptick in cases. 10 TV's Colin Dorsey is live tonight after talking with health officials about this recent uptick and also an industry that's still feeling the initial effects of that shutdown in 2020. Colin.
Yeah, Andrew, it's back. I mean, I guess it really never went anywhere, but we are starting to see an increase in COVID cases like we have around this time of year for the past couple years. City health leaders say this is expected and it's just part of the post-pandemic world. And those working in the restaurant industry say they just kind of learned to work around it and it's part of doing business.
Thanks, brother. In the last 3 years have probably been the toughest that I've ever worked in or managed in a restaurant.
Tyler Bruce has been at Saucy Brew Works since it opened during the pandemic. COVID is the only thing this location is known. For restaurants working to serve you up some tasty dinner like this one,
COVID-19 related hospitalizations in the U.S. are on the rise again. In the last 2 weeks, the number of people hospitalized with COVID rose by more than 12%. And according to the Centers for Disease Control and Prevention, over 9,000 people were admitted with the virus, representing a 12.5% uptick.
24 states saw a 12% increase, while several others, including Maryland, Alabama, Alaska, Florida, to name just a few, saw more than a 20% jump. Now, New Hampshire had the biggest leap, with hospitalizations jumping 96% in a single week. Meanwhile, North Dakota, Minnesota, and Arizona experienced the least number of COVID-related admissions. Now, those percentages, as we were saying before we started the segment, can be
affected by the original.
COVID hospitalizations are on the rise, and it's the first increase we've seen so far this year. So this comes as many students are heading back to school. Fox 5's Kim Leffler talked to health experts to find out how you can keep your family safe.
According to the CDC, COVID-19 hospitalizations have increased since the beginning of July. Experts say testing and vaccinations are key to stopping further spread. According to the latest data from the CDC, COVID-19 hospitalizations increased by a little more than 12% nationwide the week of July 16th. While those numbers were still much lower than the same period in previous years, it does mark the biggest increase in 2023.
And what's very unusual about this increase compared to other increases we've seen in the past 3 years is this is actually not due to a new variant of concern. This is still the same circulating variants we've had since the beginning of 2023.
In Georgia, Cobb, Paulding, and Cherokee counties all saw significant hospitalization increases in the same reporting period. Colquitt County in South Georgia saw one of the largest changes nationwide.
This is likely based on a combination of summertime and people are getting together, travel, a lot of engagement, and probably also based on the fact that most people are not tested anymore before they get together.
Tonight, health experts are watching an uptick in COVID-19 cases here in Georgia.
Yeah, they say that this is the first significant increase this year, but overall, that risk remains relatively low. And we want to welcome 11 Alive's newest reporter, Grace.
And hospitalizations are on the rise, and health officials are pointing to a new variant, EG.5, also nicknamed Eris. So what do we know about it, and should we be worried?
COVID cases are rising as federal regulators review a new vaccine.
We're seeing a spike in the amount of cases.
COVID cases on the rise.
It's something that we're watching closely.
As a new subvariant gains traction nationwide, EG.5.
Back with a disturbing headline about the coronavirus cases that are now on the rise once again, with hospitalizations up over 12.5% from just last week.
With children getting ready to head back to school, what does this mean for them and their parents? Joining us this afternoon, Dr. Sharon Nachman, the Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. She's going to talk to us a little bit more about this. Dr. Nachman, thank you so much for being with us.
Thank you for inviting me.
So let's start with this. How concerned should we be about this spike in COVID cases?
Well, in general, I think of the spike in the summer as giving us a sense of what's going to happen in the fall. When we look at the spike last summer, and we saw it around the same time as now, it told us that the fall and the winter may be a problem, and that's
EG.5 is one of the sublineages of Omicron that is in circulation. In terms of its behavior, it has an increased growth rate, as we expect all of these sublineages that are emerging. We don't detect a change in severity of EG.5 compared to other sublineages of Omicron that have been in circulation since late 2021. What is important is that today, we will be classifying this as a variant of interest. It was a variant under monitoring. We need to ensure that sequencing continues. The virus is evolving. The virus is circulating in every country, and EG.5 is one of the latest variants of interest that we're classifying. This will continue. And this is what we have to prepare for. We need countries to continue sequencing and sharing with publicly available databases so that our technical advisory group for virus evolution can monitor, can assess, and can conduct these risk evaluations and publish them regularly.